parotid swelling. They ask, is it asymptomatic, progressive, painless? Does it fluctuate in size after eating? Which makes sense. But then the questions get bizarre.
They cast a very wide net.
To say the least. If I go to the doctor with a swollen cheek, I'm expecting them to look at my mouth. But these notes are telling them to ask about my joint pain, severe dry eyes, xerophthalmia, and if I'm taking contraceptive pills or anti-thyroid drugs.
It seems totally disconnected.
It really does. I mean, I sort of liken the parotid gland to a car's check engine light. It's a dashboard warning for a problem deep inside the engine.
If we connect this to the bigger picture, that analogy is perfect. The glandular system sits at the intersection of entirely different medical fields: rheumatology, endocrinology, immunology.
So knowledge of the whole body is required to treat a single lump on the face.
Exactly. Take Sjogren's syndrome, for example, which the notes heavily emphasize. It's a systemic autoimmune disease. Your immune system gets confused and starts producing autoantibodies that specifically target your body's own moisture-producing glands.
So it attacks the parotid gland, causing that swelling in the cheek.
Yes, the inflammation makes it swell. But those same antibodies are circulating everywhere. They attack the tear ducts, causing xerophthalmia or dry eyes. They attack smaller salivary glands, causing xerostomia or dry mouth.
Right.
And because the immune system is highly cross-reactive, they can even target the filtering units of the kidneys, causing glomerulonephritis. Or you might see joint pains from gout or reactionary lymphadenopathy from scalp lesions.
So a painless swelling in your cheek is the thread that unravels a whole body crisis. And that explains the medication questions too. Because drugs circulate systemically, a hormonal shift from a contraceptive pill can actually manifest as a lump on the side of the face.
Yes. And for the submandibular gland, which is under the jaw, they check for dental pain, nasal obstruction, or bleeding.
Because the parotid gland is a systemic alarm bell, physically examining it requires the doctor to go on this wild anatomical scavenger hunt, looking in completely unexpected places.
The geography of the head and neck is incredibly crowded.
Yeah, the notes say they have to inspect the parotid duct orifice in the mouth and palpate for salivary stones. And then there's bimanual palpation.
That's where it gets really hands-on.
Right. The doctor has to push the tonsil medially towards the center of the throat and feel for a bulge in the lateral wall of the oropharynx. So to figure out what's wrong with the side of my face, you have to reach into my throat and push on my tonsils.
This raises an important question about how we visualize our anatomy. We tend to think of the cheek and the throat as completely separate rooms in the house, but the parotid gland has a deep lobe that wraps around the back of the jawbone and extends inward near your throat.
Oh, so if a mass grows there, it doesn't push outward where you can see it.
Exactly. It grows inward, mechanically displacing its neighbors. It pushes the wall of the throat and the tonsil inward. When the doctor feels the tonsil bulging, they are diagnosing the cheek by feeling the architectural displacement of the throat.
They also perform a salivary massage to check glandular output. But the weirdest part for me was the ear connection. The notes mandate checking the ears. An infection of the pinna, the outer ear or the auditory canal, can enlarge a parotid lymph node.
It's all about the drainage plumbing. The lymphatic fluid from your outer ear naturally drains downward directly into the preauricular lymph nodes,
Which are located inside the parotid gland.
Right, so an ear infection causes the nodes inside the parotid to swell massively. The parotid tissue itself is completely healthy, it's just housing the lymph node that's fighting the ear's battle.
And the notes mention one more ear connection, a glomus tumor. A tumor in the ear can actually push the parotid gland outward.
Yeah, a glomus tumor is a vascular mass in the middle ear. The skull is rigid, right? So if the tumor expands in that tight bony box, it has to find an exit. It pushes outward and literally shoves the parotid gland forward into the cheek.
That is just incredible. The doctor looks at a huge bulge on the jawline. But the real culprit is a tumor hidden inside the skull pushing the jaw out of the way.
Exactly. It really highlights how tightly packed that real estate is.
Well, just summarizing the incredible journey we've been on today, from reading the geographical edges of a skin ulcer to determine if it's tuberculosis or a healing wound, to using a stethoscope to listen for a machinery murmur in a vascular knot.
And of course, discovering how a swollen cheek can secretly reveal gout, Sjogren's syndrome, or an ear tumor.
Right, it's a lot to take in. But for you, the listener, I think the biggest takeaway is that the human body is a masterclass in interconnected design. Nothing happens in a vacuum.
Yeah, everything's wired together.
A jagged tooth, dry eyes, or a painless swelling. They are all parts of a complex internal communication system. So what does this all mean?
I think these clinical notes show us how much vital information is hiding in plain sight right on our own bodies. And it leaves you with a thought. If our bodies are constantly broadcasting these physical clues, what subtle, invisible signals is your body sending right now that a trained detective could read like an open book?